Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you indeed. We are very happy to be celebrating our first anniversary. We've been coming to you from this station, 1190 AM, 107.5 FM, and through our Facebook and YouTube platforms, also a podcast through AARP, Arizona Hispanic Connection. Very, very happy. 52 shows. This is show number 53. Today we are addressing a very important subject, and it is called Ahcccs. And even though it sounds like access, you know, the word access, the noun access, like to have access or to access your account kind of thing, is really an acronym. Ahcccs in Arizona is AHCCCS, which stands for Arizona Healthcare Cost Containment System. So when we talk about Ahcccs, remember, it's an acronym. And we have today two very special guests, and I am very, very thankful because I realize that getting up early on Saturdays is not easy. You work all week, and you want your Saturdays to, to take it easier and stay home and rest. But I really appreciate it. I want to thank Patricia Barraza. She is the president of Valley of the Sun Medicaid Planning. Welcome, Patricia, to our show.
Thank you. It's a pleasure to be here.
And we also have Cynthia Aragon. Yes, you were here 6 months ago, and you just had your baby. It's six months ago. You were almost due when you came, and thank you so very much, Cynthia. You are with helping families in need. And just briefly, first of all, thank you for being here. And if you can just kind of let us know what it does helping families in need carries out in the community.
So Helping Families in Need is a nonprofit organization. We have 13 locations across Maricopa County Valley where we have application assisters that help families enroll into Ahcccs and food stamps, cash assistance, a lot of the benefits that the state provides, and also the Affordable Care Act.
Right. Now, organizations such as yours, nonprofits, you really don't compete with anybody, correct?
No.
You're just there to be available for anybody who wants to apply primarily for the Ahcccs provided program, so to speak, right?
Yeah, so we're not biased. We don't tell families what plans to enroll to. We just help them apply for the program and mainly educate and also provide outreach about these services and how to help them, make an appointment with their primary care physician, their pediatrician, and just help them educate, basically.
Perfect. Thank you so much. Now, before we start to explain this Ahcccs thing, I would like to take us back to history a little bit. I always like to connect all the issues to history. In 1929, we have the Great Depression. The market crashed, the stock market. There was about a 25% unemployment. About 10,000 banks went bankrupt. People lost their savings. They were suffering. They were going through a very, very harsh time. And in that context, there was the Franklin D. Roosevelt became president, and he had a tough job to do, coming into the Great Depression. He actually governed for 3 terms from 1933 to 1945. And he is known as the New Deal president. They know him as the New Deal. And the reason is because you needed a New Deal with all these kinds of issues going on in the country back in the early 30s, correct? So he basically brought in many programs in the realm of economic recovery. They needed an economic recovery. They needed job creation because there was no job. There were no jobs. And then also in the realm of investment in public works. So all these kinds of programs are part of this packet, if we want to call it, or a package of programs called the New Deal. And as part of the New Deal in 1935, they also called him FDR, right? Franklin D. Roosevelt. He signed a very historic, almost monumental law called the Social Security Act into law. This is to guarantee some income in retirement with the Great Depression as a background. Imagine, this is the Great Depression. He comes in to govern, and he's got a tough job to do, so he brings in all these kinds of programs, and part of those programs is the Social Security. The interesting thing is that they thought that they wanted to add health care into the Social Security Act. And this is following the pattern of other Western democracies. There was the intention to include it, but President Roosevelt decided not to because he believed that it would be too controversial and would damage the prospects of the other programs that he wanted to pass. Mm-hmm. So then President Harry Truman, he proposed a national health insurance program in 1945 and again in 1949, but the proposal failed in 1950. In an effort to strengthen the resistance to the idea of a federal government healthcare program, during the 40s and 50s, the government solidified the private healthcare system through corporate tax breaks that subsidize companies that offer health insurance to their workers. And many were brought into the private healthcare system. Many advocated for a government healthcare program, and in 1960, John F. Kennedy, then senator from Massachusetts, announced his support for Medicare during his presidential campaign. As we know, John F. Kennedy was killed in 1963. Lyndon B. Johnson became president in November of 1963, and he was determined to pass Medicare. In other words, the healthcare component that they wanted to pass originally in the Social Security Act. He considered Medicare and civil rights as part of a second New Deal. Medicare is signed into law as part of the Social Security Amendments of 1965. Oh, my birth year, 1965. Former President Harry Truman was the first one to enroll in Medicare. Isn't that interesting? Well, and this is the way that we come to 1965, where Medicare becomes law. And it's also important, typically when we talk about the passage of Medicare, we don't include Medicaid. Mm-hmm. But Medicaid was part of Medicare, right? In other words, Medicare and Medicaid were passed together. And we're not here to explain Medicare. We already had a show on that, and we will have more. But we're here to explain Medicaid. So the difference between Medicare and Medicaid is that Medicare is for people 65 and over, or unless they've been on disability for 2 years. And it has nothing to do with income. But Medicaid has to do with income. You have to qualify for Medicaid. Now, the Medicaid is a combination of federal and state funds. So not all the states adopted Medicaid right away. And to make the very long story short, Arizona was the last one to adopt Medicaid in 1982. When in 1977, the CHIP program was passed. And CHIP stands for, do you know what that stands for, Cynthia?
Children's Health Insurance Program.
Right. So in 1977, we have another program that has to do with children. Then in 1989, Altcs was adopted in Arizona. And Altcs is Arizona Long-Term Care Services.
System.
Altcs, Arizona Long-Term Care System. Then in 2010, the Affordable Care Act passed with the option of states expanding Medicaid, and Governor Jan Brewer then accepted the funding and expanded Medicaid. So that's how we come to talk about AACCs, because, let me explain this and we're going to go on our first break. Medicaid in Arizona is AACCs. So when we're talking about AACCs in Arizona, we refer to Medicaid. And again, AACCs stands for the Arizona Healthcare Cost Containment System. This system offers acute health plans, long-term care plans. It offers some financial helps, and it also helps those on Medicare with something called the Medicare Savings Programs. A lot of stuff. I know I dumped it in one segment, but we'll come back to talk about what is exactly what does AACCs offer and what is long-term care, which is very, very critical. Stay with us. This is AARP Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. We are addressing AACCs, which is healthcare in Arizona. And I'm going to ask my first questions to you, Cynthia, if you don't mind. Sometimes people say, oh, yeah, I have AACCs. Help us understand what are the different programs that AACCs offers.
So AACCs provides several programs. As we had mentioned before in the first segment, they provide the CHIP program, which here is known as Kids Care. It's the Children's Health Insurance Program. That was enacted about 2 years ago. It had been frozen, but the state of Arizona was able to receive funds to open that program again and fund Kids Care. And that's for families. Again, it is income-based, but it's for families that can earn a little bit more than the regular income qualifications for regular AACCs. So they can earn a little bit more, and they do have a small copay to pay for the premium in Kids Care, and it only enrolls children 0 to up to 18.
Up to 0 to 18, and there is a small premium for those that qualify for Kids Care.
Yes, so usually the brackets depend. It's usually no more than $70 for one child, and that varies with how many children they have, and their income, again, it's dependent on that. And then AACCs also provides, obviously, the acute care, which is, the physical and mental care that it encompasses. And then, as we mentioned before as well, it has Medicare Savings Program, where Medicare members can apply for that program under AACCs and see if they qualify. Again, it's income-based. The AACCs will see if they can pay for their copays and pick up that tab for them.
So we have the Kids Care, which the federal name for that is CHIP.
Yes.
And we have the acute care plans, which is basically what people refer to when they say, oh, yeah, I have AACCs. They basically refer to an acute care plan. And an acute health plan is basically the difference that would be a long-term care, right? So you have your short-term kind of plan that would be an acute care, and then when people go to the long-term care, then that's the other side of it.
Yes.
So that just to kind of make a little difference between the acute cares. And then you say that that people on Medicare, there are these programs that are called Medicare Savings Programs, and sometimes people that are on Medicare do not pay the premium for Part B, I understand. And in some instances, they may even, if they owe a penalty, if they have to buy the Part A premium because they don't have enough credits, et cetera, work credits, then this Medicare Savings Programs pays for that as well. And if there's like a penalty, and we might have enough time to get to those a little bit more in detail. So you're saying that Ahcccs is basically the system, the umbrella, right?
Yes, that is correct. And all these programs fall right under it.
Perfect. I actually spoke to someone from Ahcccs. I invited them to come in, but they couldn't make it. I think it was too short notice. And she told me actually that it's 1.9 million. So that is just a lot of people in Ahcccs, 1.9. And Patricia, you were telling us how many of that 1.9 million are in Altcs?
38,000.
38,000.
And that was for April.
Now, but I do recall, a little bit of research that I did, that is a very low percentage of the people, but the expense that they incur is like something like 25%. I believe I saw that in the Ahcccs website, that whereas people on Altcs, which is the Arizona long-term care system, only are, say, 4 or 5% of the Ahcccs population, they incur a cost of 25% of what Ahcccs spends. So that tells us how expensive. And we are going to be able to address Altcs in just a bit. We're starting with the other programs that Ahcccs offers, but we're going to come to Altcs. And Patricia is an expert on Altcs. She spent how many years, Patricia?
14.
14 years with the Altcs program.
With the Altcs.
And you were helping people basically enroll and go through the process, or what was your main function there?
I was a financial supervisor, and I supervised anywhere from 4 to 13 specialists, and most of the time we denied people. Unfortunately, most people did not know how to answer questions, or they failed the medical part, which is the most crucial part of the Altcs program.
Okay.
And that's where we lost a lot of people.
And what do you mean lost? You mean
in other words, they didn't qualify.
Okay. And we will come back because I am very interested in addressing Altcs, because this is a very important subject that a lot of times is not addressed. And there are ways. We want to know the options that people have, because nobody thinks of long-term care. And in a bit, we will be making or differentiating what kind of services an acute care plan offers versus the Altcs plan. It's very different. It's very different. So coming back to Ahcccs, Cynthia. So how I understand that even though Arizona was the last to adopt Ahcccs or Medicaid, that we have one of the best programs in the country. And I believe we were the first ones to basically employ the managed care concept or system. And so what is managed care, and how many providers do we have in Arizona in the Ahcccs program, roughly?
Currently, we have about 7 providers that provide services to members that are enrolled in Ahcccs. And we have about 2 new that are coming in, and those are going to be enacted starting in October.
Can you just mention names, whatever you?
So we have
the name.
We have Care First Arizona.
Care First
we have
Arizona.
United Healthcare. Magellan Health is going to be a new program.
Okay.
There's going to be Steward Health Choice, which they actually changed their name. It used to be Health Choice, but now they're changing it to Steward Health Choice starting on October 1st. And then we also have, I don't know if I mentioned United Healthcare,
Right.
but
Is there one with the name Banner? Or
yes, Banner
okay,
University.
I remember.
Yeah,
Okay.
they changed their name as well, but Banner University is also one. HealthNet, that's also Mercy Care.
Right.
Mercy
So
Care.
when people come to you, there is an application. I know that people can go through Healthy Arizona Plus, correct?
Correct.
Healthy, in other words, health
The letter
and the letter E, Arizona spelled out.
Yes.
And then plus. AARP.gov. And if anybody wants to navigate the system by themselves, they can surely go and apply through that website. But typically, I have to believe that many prefer to go to agencies such as yours.
Yes.
So they come in, and then what do? You have to check what?
So when they come with us, we pre-screen them. So we ask for their incomes, how many families are in the household, how many members are in the household, and basically see if they would be able to qualify before we even start the application, because it can be very lengthy. And, if they don't qualify, we have resources for that as well.
So basically, you don't want to go through the process of completing the application without the screening process to kind of know exactly whether they're going to be qualified.
Yes, correct. Because at that point, then we can complete the application. Like I said, Access is very much income-based. So that's really the main qualification to enroll into the program.
And when somebody is approved, they assign them to a plan, or they can pick and choose.
If they're new members, if they haven't applied before and this is their first time applying, they have the option to pick their own plan.
Okay.
And every year they have the option to change it.
Once a year?
Yes.
Only?
Once a year.
Okay. So anybody, if they don't like a plan, or maybe they want to follow a doctor that moves from one plan to the other, they can move to that plan to stay with that doctor they like.
Yes,
example.
that's correct.
Or medicine. Sometimes medicine
It's not covered
become an
under-
issue if all of a sudden they don't want to cover a certain medicine, and another plan covers it. Then they move to that plan, so they can follow the medicine or follow the doctors, and that's
Yeah, so
okay.
we can unfortunately advise which plan is better or anything, but we can advise them, to help them do their research to make sure that they pick a plan that's right for them. So we always tell them to make sure that their doctor is in network with that.
Okay, I think that before we go on our second break, there's a concept that I want to ask you to explain. It is called the federal poverty level, because all the benefits that have an income eligibility requirement are based on a federal poverty level. What is the federal poverty level? Not how much yet, but the concept.
That's the percentage that Access takes in when they do their screening to see if they'll qualify. So their income is placed on that federal poverty percentage level.
So that's basically an amount that the federal government sets that determines, okay, whoever's above this is not considered poor in this country.
Correct.
Whoever makes this money or less, they're considered poor, and therefore may be eligible for the benefits that are based on income, correct?
That's correct. And unfortunately, there's not very many. Access does not take in any expenses that you might have.
That's not good, huh?
No, they just look at your gross income and base it off that federal poverty percentage.
Now, let's understand that if somebody's married, then that 100% of federal poverty level per se becomes higher. If they have a child, then it becomes higher. Two children becomes higher, 3 children, and so on. So the basis is considered on an individual basis, but then once another person is added, that increases, and so on and so forth.
It is considered now into a household percentage.
So all the benefits are considered based on the federal poverty level. So one program may be at 100%, the other one may be at 250 or 120 or 135% of federal poverty level, depending on what benefit it is. That's the percentage of federal poverty level that will be used to determine if a person will qualify. Correct?
So for Access, it's no more than 133 federal poverty level is the percentage, 133%, and then for Kids Care, it's no more than 138.
So briefly, we have about 10 seconds to 15. What happened with the Medicaid expansion? So basically, when we expanded Access, what really happened there?
So when the Medicaid expansion happened, we were able to encompass childless adults.
Childless adults. So before, if someone didn't have a child, they wouldn't qualify?
You wouldn't qualify. Now it encompasses them, and it encompasses children. It encompasses, it increased the percentage as well.
So now it's 135 versus 100% of federal poverty level that was before the Medicaid expansion.
Medicaid expansion.
Thank you. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP, Arizona Hispanic Connection, a very important subject today, AACcs. And AACcs is Medicaid in Arizona. We have addressed a few of the programs that AACcs provides. And, you know, there's always, let's keep in mind that the reason why the states took some time to adopt Medicaid is because they have to pay money. So when Medicare is all federal money, but with Medicaid it's a combination of federal funds and state funds. So the states may say, you know what, we don't have funds, we don't have money, so we don't want that Medicaid stuff, right? But eventually there's also the argument that by paying a little bit or some paying a share, by the state paying a share, it invites funding from the federal government. And let me read to you just a few lines that I type here because I think it's important to understand. Medicaid funding plays a key role in health care. It provides a revenue stream for hospitals and other providers, and it helps to reduce the burden of uncompensated care costs on employers and localities. Though it requires the state match, analysis suggests that federal Medicaid matching dollars have broader multiplier effects on the state economy, with positive impacts on jobs and revenues. Not bringing federal funds to states through Medicaid would impact coverage, cost shifting, and would even produce economic impact on jobs and businesses. So it's a decision that each state has to make. Do I put in some money from the state budget to attract the funding from federal and it'll have this trickle effects, or do I not want it? And it's not an easy decision. I mean, we do have in Arizona 1.9 people in AACcs, and it could be pretty expensive. So I suppose there's room for debate, but we'll leave it at that. Let's come back to Altcs, Patricia. Altcs is something that is not, people don't think about Altcs. So I want to ask you to your impression about Altcs.
Well, Altcs is it's a very good program. I highly suggest that people think about it, especially since there are more baby boomers getting in their years, and most of them are getting dementia, Alzheimer's, Parkinson's at a younger age. Several people are not even 65, and they're already headed in that direction. And before it's catastrophic and they have a hardship, they lose their money, they're going to need long-term care.
Patricia, help us, because how would you differentiate between an acute care plan, which is what we all have? Mm-hmm. You know, when we think of insurance, it's an acute health plan. How do you differentiate that and long-term care? What are we talking about?
For example, let's say somebody falls and breaks their hip, okay, or they break an arm or their shoulder. That's an acute. Mm-hmm. That's something that, yes, it's catastrophic, but it's going to get healed. They're going to go through rehab. Then they're going to be able to continue their life. Okay. Whereas, let's say they did fall, they broke their hip, and that triggered something in their head, and all of a sudden now they have dementia. They have Alzheimer's. They don't recuperate as well as they thought they were going to. Even going through rehab, they're going to be wheelchair bound. Mm. They're unable to perform their activities of daily living. And it's going to be long-term. Okay. For the rest of their life. There
is a concept that I don't quite remember the words, but it's is it nursing?
Nursing home level of care.
Nursing home level of care. I remember that phrase. So that is kind of like a bottom line, would you say? When somebody needs nursing care level or nursing home level of care. Now we're talking about long-term care, correct?
Exactly. And it has to be for long term because you can be on nursing home level of care for a short time. And that's if you do your rehab, your therapies, and you get well, then you're not going to be at nursing home level of care.
Now, I'm sure that you understand and that you know that when we talk about nursing home, long-term care doesn't have to, a person doesn't have to go to a nursing home to get long-term care, correct?
Exactly.
It can happen in other places?
Oh, yes, definitely. As a matter of fact, Altcs prefers the person to remain at home, receive services at home, and not go to a nursing home because that can be very costly, anywhere from $7,000 to $9,000 to $10,000 a month.
At what point, or what is the process for a person to be approved that care?
It depends on the person. If it's a single individual, they cannot have more than $2,000 in resources or assets, meaning anything that can be converted into cash, life insurance, bank accounts, 401ks. So for a single individual, the money is very low, very minimal. Income, gross, they cannot earn more than $2,250 a month.
That's from the Ahcccs eligibility guidelines. That's 300% of federal poverty level.
Correct.
So from what I gather, this is a very concrete type of care not covered by the acute care plans. And it has an income eligibility requirement as well as a condition. So just because you meet the income, you don't just get the services if you are not deemed eligible based on your condition, correct?
Exactly. Exactly.
So what is the thought process? This person is going to need what, therefore I'm going to approve. Let's say that they meet the income criteria. So what are they how are they thinking in terms of the condition of the person?
Usually my first question is, what kind of care are you looking for? If the person says, I need help with dispersing my medications, I need help with transportation, I need help with fruit preparation, those are not conditions that would qualify someone for the long-term care.
Okay.
If the person says, I need help with bathing, I need help with getting dressed, I no longer can, get up from a chair or the bed, I need help with those kind of things, then they could possibly be eligible for Altcs.
Why does long-term care, I have to use this word, scares a lot of people?
It is. It's a very scary process because it's the government, of course. Everybody says, I don't want to lie to the government. But most people are afraid of identity theft. And so when the government or Altcs asks for bank accounts, they want to know where your income is coming from, they want your social security number, that scares people because all of a sudden it's like you're giving away personal information. The other thing is they're afraid that they're going to lose their home. If they have a house that they have paid for or are paying for, all of a sudden they've heard that the state is going to take their house away. And
let's not go into all the details, but to my knowledge, long-term care is long-term care is the only benefit by which the government can go after your assets after you pass. Is that correct?
Yes,
not going
and
into
no.
all the details.
Yes and no. It's not your assets, it's your home, the home property.
Okay.
That's the only item.
So people the government can go after part of the sale of the house if the government provided some long-term care. If you don't know how to protect that, because there are ways to protect it, correct?
Yes.
I believe that I believe that it's not natural for us to prepare for long-term care. We never think about that. If somebody's younger, they're not there they're not in their 60s. How does one think of long-term care and prepare for it?
Most people don't. They all wait until it's crisis. That's the bad thing. It's when it's crisis. If you think about 5 years ahead, that would be your jumping point. Because Altcs or the state has a 5-year look-back period before they penalize somebody. So if you start with having health issues, you may be in the process of starting for that long-term care. I would prepare 5 years ahead of time.
Okay, and we're going to cover that in the last segment because this is an amazing subject, Patricia. So, are there policies that people can buy before they get there? A long-term care policy?
You're talking about insurance?
Correct.
Yes, there is.
Okay,
And
so if somebody has the money and they're thinking about it and they just want to get ready, there are policies, and I understand that the younger you are when you purchase them, the cheaper they are.
Yes. And that's a good thing to have, is a long-term care policy.
And I know that many financial advisors will pound that on people. You need long-term care and this and the other. Of course, they want to sell policies, so they're going to tell you need everything. And probably you do, but a lot of times money is limited.
Exactly.
So one way would be to buy a policy. Then are you familiar with another concept that you can move retirement money of some sort and literally buy the care and it's making money at the same time, and then are you familiar with that concept or not?
It's something that financial planners,
okay, yes. I have heard that there's a way for you to use some of the money that you've saved for retirement and somehow buy
it's an annuity.
Okay.
Yes,
okay.
It's an annuity. And there's some that are going to be good, and there's some that you can buy at crisis time for the couples.
So if you did not buy a policy, you're going to have to do something at that end. And then there's the last alternative, Altcs. So Altcs is almost like a safety net when you didn't plan, when you don't have anything, and when you have spent literally all your money, then you can come and Altcs will catch you and provide, unless you're able to protect, correct?
Exactly.
But there's ways by the state planning to protect your what would otherwise make you ineligible for Altcs. And let's see if we can address some of those things in the last segment. Stay with us. We are addressing Ahcccs Healthcare in Arizona. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
This is AARP Arizona Hispanic Connection. We just have a few more minutes. This is a very, very important subject. Before we go back to the Altcs, I just have maybe three things that I would like to mention about Ahcccs, Cynthia. What is emergency Ahcccs?
So Emergency Ahcccs is a program that's available for individuals who don't have a legal status here, immigration status. And basically what that encompasses is just emergency services. So
is that for just one condition, or it's open?
It's open,
Okay.
but it has to fall under the regulations of it being an emergency.
How about for pregnancies, pregnant women?
So a lot of the times when women are pregnant, if they didn't qualify for Ahcccs before, because maybe they made too much, for pregnant women, that's actually increased a little bit, their income. They can earn a little bit more to qualify for that program.
Okay, so let's see if I can find that percentage here real quick. It's 156% of federal poverty level.
So compared to 133 to 150.
Yeah,
a lot.
and I want to go back to Altcs, but let me just make the final comment. The acute care plans that people have, the Ahcccs plans, they're going into they're going to be more integrated plans. They're going to be integrating the physical health care and the mental health care. So if you are in Ahcccs, please, you're going to be sent a letter. And I wish that the Ahcccs representative would have been here to give more details, but this is all I want to say. They will be integrating the care. the physical and the mental, it's going to be care. It's going to be more of a one network within
Yes.
one network, because in the past the mental health care used to be a
separate.
little bit more of a more difficult to navigate. So now they're going to make that easier. So please be looking for that letter. They're going to be sending it to you, and then make sure you read it and understand it. If you have questions, they can also always call
Yes.
Helping Families in Need. Let's go back to Altcs. So we can conclude that many people do not prepare for long-term care. We're not even thinking about it. We might not even have the money. Second, people who want to can buy insurance, long-term care insurance, but then Altcs is an alternative. So let's say somebody has 3 houses or 2 houses and lots of money. I don't know, $500,000. What is expected of a person like that? Because what we're talking about here is that when a person needs long-term care, family members step in, right, to be caregivers, and that's when it gets very difficult, because the person who is going to be the caregiver, their life totally changes. They probably may be without a life anymore. So that's where the long-term care comes in, because they can provide the care literally free of charge. So paint me a scenario of people who, maybe middle class, maybe they have 2 homes. What does their scenario look like in terms of getting Altcs?
For married couples, that scenario is more for married couples.
Okay.
Altcs does not want the well spouse to be indigent when they need care. So they've allowed their assets to be greater than for a single individual. So a married couple can keep up to $124,000. What is it? $123,600 in assets. That does not include a house. So,
Okay.
They have the $123,000.
So they separate assets and the house?
And the house, because the
Okay.
house is, as long as you live in it,
Right.
and it's not in a trust, that's not a countable asset. That
Okay.
and 1 car.
Okay.
So let's say a person has 3 houses, and they have over $300,000 in assets, IRAs, 401s, savings, so on and so forth. However, all those houses have mortgages, so maybe their cash values are very minimal.
Okay, so they're going to consider the cash value.
They're going to consider the cash value
Okay,
of
not how much the
2.
house is worth.
Right.
Okay.
They're going to consider one of the houses, if they're living in it, as they're not going to count that one. But the other 2 that they're not living in, they're going to count the cash value.
Okay.
So add that to whatever money they have, then they're going to allow them up to that $123,600.
What is the concept of spend down?
Spend down just means that, spending their money down to whatever limit Altcs says they are allowed to have.
So basically, it's like the government saying, you know what, I would like to help you, but in order for me to help you, you have to pay for your own care first, because you have some money.
Exactly.
So use your money, pay for your care, and when you bring your income levels and assets to the appropriate levels that we approve, then we step in and help you. Is that kind of like the concept?
That's the concept,
of
yes.
of spend
A
down.
spend down.
And there is that. I mean, I'm sure many people go through it.
They do, because there are ways of spending down that people can actually keep either most of their money or all of their money.
Paint me a scenario where the government goes after a person's, a portion of the sale of a home after the owner dies.
This would be for a single individual.
Okay.
A single individual gets on Altcs. They do have a home property. It has been conditionally excluded, so they didn't count it. However, they did put a lien on it, because
Who puts a lien on it?
the state.
Okay.
It's called, they have a state lien and the TEFRA lien. What that means is that it's like taking a loan from the government. And so when the person passes away, the state wants to recoup that money they've paid on their behalf.
Of course.
And so,
It's almost like saying, well, you have money to pay now, but I'm not going to force you to sell your home, because then where are you going to live? So I'm going to give you the care, but if when you pass, I'm going to get some of the money that I invested in
Exactly.
you back.
Exactly.
So you're saying this only happens with single people?
Well, it can happen to the married couples, but because the well spouse is living in that home, that's one of the exceptions that there would be no lien. So even though they did do it, because the well spouse is still there, they're considered a surviving spouse and not subject to recovery.
Now, you no longer work for the Altcs,
state.
the state, and you started your own company. What type of scenarios, cases do you see in your business?
Well, people call and ask for help. These are people who, crisis situations. Very rare do I get someone that needs long-term care ahead of time.
Right.
And so I always do a pre-screening and find out what is the medical condition. That's my very first, question, because if they're not going to be medically eligible, there's no point in doing any
Once
of the
the medical condition passes, then the financial you can work somehow.
We can work it somehow.
So that's critical, the condition. Now, is the doctor a doctor diagnosis involving here?
Yes, because Altcs will want to look at medical records, and there has to be a diagnosis to help the score.
Okay.
A person has to score 60 or more points to qualify.
Okay.
So, yes, the doctors will be asked for their medical records.
And I know you told me you're not a financial advisor, but are you familiar with that concept of how you protect your assets so that you can qualify for Altcs without getting rid of them?
Yes.
What is that
There are
concept?
numerous ways. A person, like you mentioned, can purchase long-term care insurance, do that through the Partnership Act, or just when you're young enough, invest in a long-term care insurance. There's also trust. Now, I'm not an attorney, so it's not legal advice, but a trust, there are certain trusts that can be used to protect assets. However, they are subject to the 5-year look-back.
Okay, let's explain that. So basically, let's say that I foresee that, or maybe I'm already having some need, and then I said, I got to get rid of all my assets so that I can qualify. So you're saying the government will say, I look back 5 years and you had all this stuff and you got rid of it. Nope. So then you're gonna be penalized. How are you penalized?
The person is penalized, and what that means is that if the gifting or putting it in a trust or giving it away, getting rid of it, basically.
Right.
If you did that within the last 5 years or 60 months, and then you apply for Altcs and you're within that window, they're going to penalize the full amount by the private pay rate that for the county you're in. So for Maricopa right now, the private pay rate is $7,134. So let's say you gave away $500,000, that included your house and everything else. They're going to divide that number by 7,134 and come up with a number of months the person is not eligible.
Okay. So depending on how much money you got rid of, that's going to determine how much they're going to penalize you in months. In months,
and meaning you're not going to get help long-term care. You'll get the acute side of access, but not the long-term
So they're
care.
not going to, the 5 year doesn't mean that they're going to deny you for 5 years. It just means that they're going to look back 5 years and determine how many months you're not eligible.
Exactly. So let's say someone gave away $500,000, but they gave it away 5 years and 1 month prior to applying for Altcs. So when Altcs asks the question, did you give away, trade, or transfer anything? The answer is no.
Yeah. This is amazing. And I know, one of the reasons, or the reasons we address these issues is not necessarily to give all the nitty-gritty details, but we just want the public to get a good overview of all these programs. Starting with Social Security, then Medicare and Medicaid, and then how the states decided to take in Medicaid because they knew that they had to put it was a combination of funding from the government, federal and the state. Some decided to do it. Arizona was the last, but then eventually we have a very, very good access program, one of the best in the country. And then you have your kids care, and then you have which is CHIP, and then the programs that help those on Medicare to pay for the Part B premium. A lot of times people say, I don't pay I don't pay for Medicare. Well, yes, you don't pay, but the state pays, right? Because the state pays. So there's just so many programs that Access provides that is just amazing. Again, it's a huge program, and it's based on income, and in the case of Altcs, is based on your condition. Final thoughts in a few seconds. Actually, we just have a minute. Just very brief. Final thoughts.
So I just want to say there are some changes happening here with Access that are going to be enacted in starting October 1st, 2018. So they are going to be getting a letter in June, end of June, about plans that are going to be changing. And then if consumers want, if members want, they can change their health plan at that time. They have until July 31st.
Perfect.
To change it or keep it. Or
Thank you, Cindy, for being with us. Final words, Patricia?
I think that people need to apply for Altcs. It's a good program. Don't be afraid.
And you can help them.
And
Can
I
they
would be
find you
happy.
online?
Yes, my website is vosmedicaidplanning.com.
Thank you very much to the both of you for being with us. And to you that joined this program today, we're celebrating our first anniversary. We're very happy. Thank you so very much. Have a great week. This was AARP Arizona Hispanic Connection.